Night curfew in Karnataka tonight. It begins from 10 p.m. and will last until 6 a.m. The Karnataka government has imposed night curfew till the 2nd of January. The Karnataka government has, like I said, imposed this night curfew from 10 p.m. to 6 a.m. and it will continue till the 2nd of January 2021. Now remember, this is interesting because it is the second state to have done this. Maharashtra, of course, being the state where the night curfew was implemented from yesterday. So this, of course, is the big development that we're tracking. Let's just listen in to what the Karnataka Chief Minister B.S. Yadurappa had to say.
In view of the new strain 19 virus and as per the advice of Government of India and Technical Advisory Committee, it is decided to impose night curfew from today till 2nd January 2021 between 10 p.m. to 6 a.m. I request all public to cooperate to prevent and contain new COVID-19 strain.
Announced that there will be night curfew in Karnataka starting from tonight until the 2nd of January. The timings of the curfew, 10 p.m. at night to 6 a.m. in the morning. Now this, of course, covers the holiday season, the festive season. Both Christmas and New Year celebrations will, of course, be affected. The state had earlier said that there would be a ban on public celebrations of New Year's Eve, that people could not have public parties. But with this night curfew, even private celebrations will, of course, be affected. The Karnataka government clearly taking the COVID-19 situation very seriously, especially, of course, with the new strain of the virus being reported out of the United Kingdom. Passengers arriving from the United Kingdom, they're being traced, and the ones who've arrived over the last 14 days are asked to actually go for testing. Those who are coming in have to be tested at the airport where facilities have been set up. And in fact, the Chief Minister also said that those coming from other countries would be required to produce a negative COVID certificate, an RT-PCR negative certificate. Now, of course, this is despite the fact that Karnataka has been seeing lower daily numbers of cases. There has been talk of fears of a second wave actually coming in January or February, and the Karnataka government certainly taking it very seriously indeed, the double threat really of potential Christmas and New Year's Eve celebrations along with this new strain of virus that has been reported. As a result, night curfew across Karnataka from 10 p.m. to 6 a.m. starting tonight until the 2nd of January. Maya Sharma in Bengaluru for NDTV.
Meanwhile, remember, there's a night curfew that's been imposed in the state of Maharashtra as well from the 22nd of December. That's effective last night till the 5th of January. Now, in an interesting development that's taken place, the hospitality industry has come out and said that they're disappointed. Pradeep Shetty, the senior vice president of the Hotel and Restaurant Association, has written to the government requesting for restaurants to be allowed to operate for 2 additional hours. They've said that the potential to generate between 50 to 70 crore additional revenue is dependent on these 2 additional hours. The industry has already been severely affected as a result of the COVID-19 pandemic, and therefore they have in fact requested for celebrations from midnight to 10:30 p.m. So this, of course, is the big development that we're tracking as far as Maharashtra is concerned. There is a sharp reaction that has come in from industry. Let's get in a quick reaction from Saurabh. Saurabh, what's the reaction as far as the government is concerned? It is, of course, a very real concern that the hospitality industry is voicing there.
Yes, I mean, both are real concerns. The fact that there is a pandemic, that's a real concern. And also the fact that, yes, the hospitality industry has suffered perhaps one of the most during this pandemic. And because of the lockdown that they've been severely hit. So obviously they were looking to do some of the business that they've lost out on in these few days. Even remember, Christmas and New Year is a time when people usually go out, people spend, people, eat out. And that generates revenue for the hospitality industry. With that gone, with the night curfew, they are staring at bigger losses than perhaps what they were staring at due to the lockdown. Now, what is the government doing? The government says it's looking at a package for the hospitality industry. In fact, it's looking at waiving off license fees to as much as 50%. And what that will translate into is a 350 crore rupees package for the industry. That's being discussed in the cabinet meeting that's going on in Maharashtra, Mumbai, at the Mantralaya at this point. Today is Wednesday, so the cabinet meets on Wednesdays in Maharashtra. And that is one of the ways that the government is trying to address the concerns of the hospitality industry. But as far as the night curfew is concerned, the government says that it's a matter of life and death, and it's a matter of a virus. It's a matter that they cannot take chances with. And that is why they say that they have to take this decision to impose the night curfew, because what they felt was that people were going out, people were partying, social distancing norms were being flouted. And that's something that they need to address in this situation in the time of the pandemic. So yes, it's a choice between the devil and the deep blue sea for the government, but really there's very little the government can do in terms of, not also bringing in these restrictions to avoid people from crowding, people from, not maintaining social distancing. So it's a concern the hospitality industry has. The government says we're looking at a package.
All right, so it is a tightrope walk as far as the government is concerned, Saurabh, like you say, between livelihoods and saving lives at the moment. And the industry has, of course, reacted. They've enlisted the fact that it's already been a year where they've incurred severe losses, and these new rules in terms of night curfews will only intensify the economic impact of the pandemic. Appreciate you, Saurabh, for joining us for the very latest. We have Dr. Ravindra Mehta, the Chief of Pulmonology and Critical Care Apollo Hospitals, Bangalore, joining us. Asif Bhamla, spokesperson of the BJP, is also with us, and Harish Bajur, brand guru, also joining us. Thank you all very much. Dr. Mehta, how important are these steps that have been taken?
Well, basically, if you look at the worldwide scenario, this is just in line with what's happening everywhere in the world at this point. Look at Europe. I mean, 5 days ago, 10 countries already, Germany, Netherlands, Holland, Poland, Czechoslovakia, so many of them have already done this. They've done it for Christmas, which is one of their biggest festivals. It's like our Diwalis and so on and so forth. They've done it for the New Year. US is looking at 250,000 to 300,000 cases per year. A new strain is worrying everybody. So I guess looking at the worldwide scenario, our governments have little options but to put this in. The usual lives versus livelihood issue is coming up, and so it seems to be very logical at this point to bite the bullet and do whatever is required to get this under control.
Right. Asif Bhamla, do you agree with Dr. Mehta, and therefore, perhaps there are two states currently, Karnataka and Maharashtra, that have taken this decision, but maybe many more should follow suit?
No, certainly both the concerns are equally important. Of course, the concern of COVID, as well as the issue of the hospitality industry, which has taken a drobbling. It's taken a drobbling from the past more than 8 to 9 months now. So this was the only time where they could revive back. The rentals have been going, have gone up so much. They've not been able to clear all of that. So this 15 days was a sigh of hope and expectation. I mean, I understand that the government has imposed this, this curfew, but this, of 14 days. And of course, I will certainly agree on certain aspects. That is the institutional quarantine to those returning from Europe, from the Middle East. That's of course definitely, that's definitely acceptable, because that's needed, because it's coming more from there. So that's a very good move. I mean, I welcome that. Wearing masks, compulsory, distances, and avoiding huge crowds. But still, I feel, I mean, for the hospitality industry, that this is a festive season, and this is the time when people go out, they spend money, and it looks like in the daytime, if you see the buses and the trains are in how much over capacity they're working, they're anyways in the over capacity. So is it that the virus is just active the full night, and does it rest in the day? So I'm not supporting.
So you are essentially saying that this night curfew is not effective?
No, night curfew with a certain level and fabric of discipline can be certainly effective.
Okay.
I mean, if you go to see at the barb of the night curfews, there are a lot of laws that have been also. We've seen recently also there was we saw in Mumbai in a club the rules have been flaunted, and certain times the cops stand to gain out of this, by letting
those are very serious allegations that you're making. You're saying that, I mean, someone is trying to leverage benefits out of this night curfew. The cops are trying to leverage benefit out of it.
There is a section. I'm not saying it for all, What I'm trying to say is that in a disciplined manner, if this can be conducted to ensure that the, it's a question of so many jobs. It's just, these 15 days are prime business days of the entire
Harish
year.
Bijur, let me bring in Harish
Now,
Bijur
you're
for a
talking about
perspective.
reopening the
Harish
railways.
Bijur,
if you're
it's a
talking about
tightrope
other
walk.
I mean,
It's a tightrope walk for the
look at
government
this,
between saving lives and livelihoods at the moment. And Asif Bhamla makes the point that this is extremely damaging for business. This is key 15 days as far as business is concerned in these certain sectors that are going to be affected. Which side would you weigh in?
Okay. See, firstly, I think, this decision of both Maharashtra and Karnataka is a very fastest finger first kind of a decision. They've been very quick and they've been very, very clear and categorical. I'm with the decision because, if you really look at it, this is a pandemic and a pandemic is not to be played around with. And we're talking about COVID-19, which went right through 2020. We don't want it to go right through 2021. We don't want a COVID-19 version 2.0, 3.0, etc., etc. So I think government decision, excellent decision. To the hospitality industry, I would say, hey guys, I think it's a big hit. I know it's a big hit. I work in this space equally. But lose short to gain long. And I think that's the way to go.
Okay, lose short to gain long. Dr. Mehta, that definitely doesn't apply as far as medical terms are concerned. The mantra is quite different. But, respond to the point, Dr. Mehta, that Asif Bhamla makes on the, how effective is this night curfew? You're essentially saying that you can close down your restaurant till 10:30 or, by 11 p.m. Does that really help to stop the chain of transmission? In purely scientific terms, how effective is a night curfew?
No, see, it's a very clear thing that how much of resources do you have to actually put things under control. Let us step back and see one thing very clearly. There are three stakeholders over here. There is the public who has to behave itself, otherwise they'll spread the disease. There is the hospitality industry itself, which has on one side its livelihood, but they will also get affected by an unruly crowd over there. And look at your policemen and the lawmakers. They themselves cannot use physical force over here. Everything is in trouble here right now. Now, you can only put resources only so much. You cannot put round-the-clock resources. Nights are known to be disruptive, unruly. It is impossible to control. The industry itself will be overwhelmed by what's going on. So worldwide phenomena. It's not that we're reinventing the wheel out here.
Yes.
At this point, you're talking, you barely got control. Look at America. They're reeling 250,000 per day. We are proudly saying we are under control. Why do we want to go back? We should find a way to make up for the hospitality industry, involve the stakeholders.
Do you, Dr. Mehta, then believe that other states should follow suit?
Sorry?
Do you believe that other states should follow suit?
I think it's going to happen very quickly. If half of Europe is going to do it, I don't see the rest of India lagging behind when you look at these decisions happening. In the next 2 days, all will be revealed.
And how worried, Dr. Mehta, are you about the new strain?
The new strain is concerning, and that's the whole thing. In March, this is all deja vu. We said, will COVID-19 hit us? The new strain is concerning. We have just got control. It is time to pull up our socks, learn from all prior lessons, and do whatever it takes to control it, and somehow look for the stakeholders who are suffering in the process.
Right. Asif Bhamla, you wanted to come in.
Night curfew in the respective jurisdiction will reduce virus transmission is something which we're talking about, if I'm not mistaken. But having said that, I was recently, I was out in Dubai for a conclave on environment. I see with so much of discipline. It doesn't look like the virus ever existed there. It's not that I want to compare Dubai to Mumbai, but if
yes,
it's
I was
done,
just going to say, is that really a fair comparison to make? You live in Mumbai.
No.
Can you really compare?
Let me say something. Let me submit. If there are proper penalties, that have been slapped to the restaurateurs, so they will definitely maintain that the capacity aspect also. Okay. At least your revenue, the churning process of the revenue should not stop, because out of a lot of difficulty, lot of pain, lot of trouble, these restaurateurs have come to life, and now that they're barely starting to breathe at this prime time, when the business is on the pinnacle, okay. I'm not saying that keep your restrictions on the roads. I mean, don't allow the too much of trafficking to happen on the promenade espionage on locations like that where there
So,
are normal.
Harish Biju, clearly we have two sides here.
But even the restaurants, even in the restaurants, curb down the sizes, let the restaurant owners be made and held responsible. So automatically things will fall in line. And as far as social distancing,
easier said than done. You know, it's easier said than done, because is it really possible, scientifically possible, unless of course there's a cluster of infections that emerges from a particular point, for people to actually diagnose where they got the infection from? They could have got it from the workplace, from public transport, from a fellow neighbor, from a packet, from a restaurant. You can't really trace it back to a restaurant and therefore hold somebody responsible. Harish Biju, there are clearly two sides. One is, you know, a doctor's, a medical point of view, and Asif Bhamla, of course, talking about the business aspect of it. So, you know, I mean, you can't really, there's no right and wrong here, really.
Yes, no right and wrong. But the point is, I would rather go and err on the side of the medical side of it, because I think, you know, this is a serious virus and we have gone through the downsides of it for a long time. So let's not play light on this. And I would still stick to that statement of mine, you know, lose the short-term business to gain the long-term business, which will come back. But we want that long-term business to come back.
Past 8 months is a very big time to lose.
Yes, let's be patient.
People have been, the restauranters have been bleeding. The hotelers have been bleeding. I'm not saying that.
Understood.
I am saying that things can be. I have given an example of Dubai, as in, so that people
understood.
You know,
Harish, is Dubai? No. One second. Harish Biju, is Dubai a fair example to give here? You know, that's my point. Can we really draw those kind of comparisons?
Dubai is completely a wrong example.
Mumbai is a metropolitan city.
Mumbai, Bengaluru is Bengaluru. And you and I live here, and I guess we know how it operates out here. I think the paranoid will survive. Let's be a little more patient. 8 months we have been patient. Let's be patient for 3 months.
I'm afraid I'm
implemented things will work in order.
I'm afraid I'm completely out of time. There is, however, you know, one other point here, which is, you know, can it be left open to the discretion of the people? Those who are comfortable to step out should be allowed to, and those who aren't shouldn't. You know, that's another argument. That's another argument. We'll save it for another time. Thank you all very much for sparing your time. It's been an interesting conversation about night curfews, how effective they are and how important they are, especially at this time of the year.